Welcome to StantonMD. I'm board-certified emergency physician Dr. Ryan Stanton. Today we have a great show with information on cosmetic dentistry, the risks of some of the common medical conditions on the eyes, and then we're going to spend more time with Leanne Ripito talking about her battle with opioid and heroin abuse. We've spent some time now talking about your teeth and dental health, but sometimes you just want to clean up that smile a little bit. Cosmetic dentistry is a huge industry, and we spent some time with Justice Dental to talk about some of the tools and technologies to help create that perfect smile. We will then head over to Retina Associates of Kentucky to talk about some of the changes in damage associated with diabetes and high blood pressure. Dr. William Wood will walk us through the risks as well as the tools they use to help diagnose and treat this common presentation before it's too late and vision is permanently impaired or lost altogether. Finally, we were planning on having a little bit of a segment from NASCAR, but that will have to be saved for a later date because we want to make sure that you have as much information as possible on the realities of opioid abuse and the potential for recovery. We'll talk with Leanne Ripito and her family about that struggle. But first, let's talk with Justice Dental about that perfect smile. Cosmetic dentistry is a pretty wide catchment phrase which can include everything from teeth whitening to reconstruction, gum trimming, tooth alignment, and capping. The key here is that there is not one solution. Rather, it's an individual plan based on need, goals, finances, and potential limitations.
Well, cosmetic dentistry, kind of that tagline can be confusing, and I like to say that we try to make all dentistry look really aesthetic that we do. So that involves utilizing a lot of porcelain work and trying to do a lot of the dentistry in all porcelains because the porcelains transmit light better than if you say do traditional dentistry where you're using say a metal reinforcement of a crown or something with porcelain over it, and that blocks light. So as cosmetic dentistry, often people think of as veneers, and we do veneers and we love veneers, but we do what we say porcelain restorations dependent upon what your teeth actually need. So that would just depend on the condition of the tooth and actually how you present. So there's no one type of what we think treatment plan that fits everyone. You know, when someone comes in and says, I think I need veneers, you know, I want to analyze their mouth, look at it, all the information, and kind of determine what teeth might benefit from veneers. Maybe that's not the ideal situation, but whatever we do, we're trying to get a maximally aesthetic outcome.
Many will take things into their own hands at home. There are dozens of options out there for teeth whitening and treatments. The key here is to know the roles, risks, and limitations of over-the-counter therapies. Do these therapies do more harm than good?
A lot of people have those kinds of fears, and it's been proven that there's not real damage to a tooth, a good healthy tooth with bleach. Now, I wouldn't recommend someone who's lost a lot of enamel on their teeth to bleach because you've lost the real protective outer coating with enamel, and dentin is the underlying surface of enamel, and actually dentin has microscopic tubules in the dentin that have little nerve endings. So if bleach is hitting any kind of root surface or that exposed dentin, that's where you can get a lot of sensitivity. And so that's sometimes why people get sensitive. Another reason why people get sensitive is just the dehydration of the tooth. And maybe, you know, a lot of people tend to want to put the bleach on there for a long period of time, and the tooth actually is losing a lot of the hydration of the tooth just from our oral saliva. Anything like that keep our teeth hydrated. But if you cover them up for a long period of time, whether you're wearing trays with bleach or I don't know if white strips, but sometimes you'll get what we call dental hypersensitivity or sensitivity from those bleaches. So I like to tell people you really only want to bleach for about an hour. Some systems are designed for you to be able to sleep in them, and they can be fine, but everybody's teeth sensitivity levels are different, and I would just encourage people who are bleaching to use great sensitivity type toothpastes along with that, or else to seek us instead of trying to do home remedies, because sometimes home remedies aren't going to give you all the answers you need.
One of the biggest steps in cosmetic and reconstructive dentistry is understanding what is currently there and what can be. At Justice Dental, they give you that before and after with their Smile Studio. This studio uses a combination of still photographs and videos to help you understand your needs and potential outcomes based on the treatments that are available.
Right now we're taking a lot of pictures with a actual 35 millimeter camera. It's a digital camera, and we take photographs and we will download those and we'll utilize those. We'll even take a before picture, and then we will image on that picture the after smile. So we'll show you how your smile presents in a photo, and then we'll image the after photo. So this little studio, we're able to capture photographs, and a new thing that we're developing is a digital video recording to actually get video recordings and utilizing the video recording for still shots to be able to even image from a frozen smile of the video recording. But the video recording is great because we can actually watch how you speak. So we're actually seeing the position of your teeth and how you speak with that smile. So it gives us even more information.
One person that has been a beneficiary of the Smile Studio is Tiffany. Dr. Justice walks us through her case.
As you can see, we can actually image for you, which is a real benefit because people get to see what the after will look like. And that's kind of big because it's scary to get your teeth worked on and to have changes. And if you can kind of see what what you would look like after, it's very helpful. So here's Tiffany before, and Tiffany has some restorations on her anterior teeth that she might want to have changed and just kind of make look a little different. So we're going to give you the after shot, and we're kind of showing you what we can do with her smile design to give an idea of what she looks like before and then after, so that you can see this is actually a more aesthetic from a proportion and dimension standpoint for her smile than what she has now.
Depending on the work, cosmetic dentistry can be quite an investment. Thus, it's important to protect that work when it's done. One of the biggest risks is staining and discoloration.
One of the big things is coffee or tea, and the truth is if it will stain your teeth, it will also stain your restorations. And so I understand once people have made a huge investment in their smile why they would want to drink coffee through a straw, and honestly you will avoid staining by doing that. So that's kind of good. Red wine is also one of those stains, and one of the worst, unfortunately, is smoking.
No longer do you have to live with gaps in that smile. Technology for tooth replacement, whether it's one or all, has advanced significantly. Now, more and more options are available to restore those pearly whites. More StantonMD coming up, so stay tuned.
As a board-certified emergency physician, Dr. Stanton is a proud member of the American College of Emergency Physicians, also known as ACEP. ACEP provides physician and evidence-based patient resources at its consumer website, emergencycare4u.org. That site has stories, fact sheets, and advice on a wide range of emergency topics. From visiting the ER to mom tips, you can find them on emergencycare4u.org. Now, back to the show. Justice Dental provides world-class dentistry with a hand-picked team of doctors, hygienists, surgeons, and specialists that work together to create natural, beautiful, and healthy smiles. Realizing that oral health is key to overall health, Justice Dental provides everything from preventive dentistry to full mouth reconstruction, ensuring your smile will last a lifetime.
At Justice Dental, we want to do your smile justice.
Welcome back. Eyes are an integral part of our success in life. Unfortunately, the loss of vision is all too common and often the result of other chronic medical conditions. The goal is prevention, but there are some great tools out there that can assist with detection and treatment. I talked with Dr. William Wood, founding partner of Retina Associates of Kentucky, about the problems along with the tools and technology they use to keep those eyes working properly. As our population ages, we are living longer and longer with chronic medical conditions such as diabetes and hypertension. Unfortunately, both of these present significant risk to the eyes, especially diabetes. The key is early identification and thorough management.
Diabetes is exploding in prevalence and incidence. As a matter of fact, Kentucky has one of the highest rates of diabetes of any state in the United States. And early treatment and diagnosis is a key to saving vision. And diabetes is a leading cause of blindness in younger people in the United States today, and it's increasing dramatically.
In order to understand the problem, we must understand the anatomy of the eye and how diabetes affects the eye.
Both of these types of diabetes affect the retina. Now, if we look at the eye, as we can see here, and if we have a cross section of the eye, if we open up the eye, we can see that the nerve going to the brain is here, in the front of the eye here, which in the light rays that we see go through the front and into the back, and the retina lines the entire inside of the eye like an inner tube does a tire. It's very thin. It's half the thickness of saran wrap. And it is a neural tissue composed of 1 million nerves, and they all exit in a bundle or cable of wires to the brain and through the optic nerve. The center of the retina is called the macula, and that is just an area of the retina that allows us to have very fine vision, such that when you look at me, you can see my nose and my face, and also color vision. And both types of diabetes affect the retinal blood vessels, primarily, that you can see here in the arteries and veins that nourish the retina, and cause swelling in the macula. Both types of diabetes can cause blindness.
The key here is timing. The damage to your eyes from diabetes is related to time and control of your sugar levels. Dr. Wood discusses the diagnosis, timing, and prevention.
We recommend, therefore, that if a patient has newly diagnosed type 1 diabetes, it's unlikely they're going to get any diabetic problems for 5 years. So we recommend at 5 years a patient have a very thorough examination of their retina by someone trained to look at the retina. If someone develops diabetes and they're type 2 diabetic, say when they're 40 years of age, they need to be examined immediately because they could have had diabetes for 5 or 10 years and could be at high risk for blindness on the first day of diagnosis. If a woman who is diabetic becomes pregnant, she is at immediate high risk for loss of vision, and she needs to be examined at the time of diagnosis of pregnancy if she's had diabetes. The second thing that is important is the relation to blood sugar and control of blood sugar. We now know that if a person has very tight control of their blood sugar, they can prevent most of the dreaded complications of diabetes, including kidney failure, diabetic retinopathy, blindness, amputations, heart attack, stroke, and a long list of complications.
Blood pressure management is very important as well.
The systolic blood pressure is a very adverse factor toward loss of vision. We want to keep people's blood pressure with diabetes around 120 to 130 over 70 or 80. If blood pressure is 140 over 90, there's about a 15 or 20% increased risk of losing vision. And it goes up every 10 units. And so we educate our patients about blood pressure also.
There are several tools that are utilized at Retina Associates of Kentucky to help evaluate and monitor the changes associated with chronic medical conditions. Some of these tools include wide-field angiography and ocular tomography. The advancement in the technology allows detail and diagnosis that was difficult, if not impossible, in the past, as well as non-invasive monitoring of the conditions and treatments. These methods haven't come at a moment too soon for the citizens of the region as diabetes rates continue to climb.
Diabetes in the state of Kentucky is increasingly blinding more and more people. People are not aware that they need to control their blood sugar, their blood pressure, and when to be examined, which I've outlined, and to be sure that they're being checked so that these problems can be identified and treated early to prevent blindness. So that's just one of the areas in which we work very intensively at Retina Associates.
Diagnosis is only important if there's something that you can do about it once you find it. Thankfully, several strategies have been developed in order to help manage diabetic retinopathy, improve symptoms, and prevent further damage.
Treatments we have are many, but the mainstay of treatments that have been proven efficacious are injections into the eye of a material that blocks leakage and bleeding. These are called anti-vascular endothelial growth factor agents. They're a novel agent and they revolutionize the treatments and are markedly helpful. At this patient who has diabetic macular edema and swelling and fluid into the center of her eye, causing loss of vision, we give the injection, and 3 or 4 weeks later all the fluid's gone. It is really a wonderful proven treatment. These same injections are also beneficial to treat the proliferative retinopathy, where there are growth of blood vessels, because they can make the blood vessels actually regress. Sometimes you can see them and then a month later you can't even see them anymore after this injection. The second mainstay of treatment is laser photocoagulation delivered into the eye, where we're actually destroying tiny bits of diseased retina that liberate a factor into the eye, a protein that causes growth of blood vessels and leakage. And these tiny little laser marks make the eye liberate less of that factor, and so the eye reverts back to a more healthy state. That's been used for 20 years as a miraculous treatment. A third form of treatment is vitrectomy surgery, which is done currently as an outpatient basis in an operating room without involving a hospital stay or sutures in the eye, and usually does not require an extensive time in the operating room. And the patients go home immediately, and the results are quite good at reducing blindness for major hemorrhage in the eye and detached retina. And then also, we have a rehabilitation service related to low vision services of Kentucky, which can help improve the quality of life by providing magnifying lenses, lights, filters, and a whole host of devices and ancillary services and financial aid through state agencies and private grants for people with limited vision.
If you have diabetes or high blood pressure, it's very important that you manage those, take your medications, and have your eyes checked regularly to make sure your eyes are staying healthy. More StantonMD is coming up.
Do you own or work for a business that advances health and safety of the public or its employees? Then you may be interested in becoming a sponsor of StantonMD. There are various opportunities for sponsorship, from the show to the website, social media, print, or a combination. For more information on becoming part of StantonMD, contact Jen at info@stantonmd.com. That's info@stantonmd.com. Now, back to the show. With over 40 years of service, Retina Associates of Kentucky provides care for disorders of the retina, macula, and vitreous structures of the eye. Their goal is to provide the best possible care in a compassionate, personalized, and timely manner. This is accomplished through a comprehensive, state-of-the-art mix of diagnostics, medical, and surgical services. They have 10 offices throughout the Bluegrass. Visit retinaky.com.
Welcome back. In our last episode, we featured part of an interview with Leanne Ripito, a high school friend of mine that is over 10 years clean after a battle with opioid abuse. Today, we continue that conversation, talking with Leanne and other family members about what it was like, the challenges, and the recovery. We recently talked with Leanne about the experience of addiction, and today we want to talk more about the impact near the pinnacle of the addiction and the road to recovery. Leanne recalls how something that seemed relatively benign at the time nearly ended her life and destroyed her family.
When I look back on it, sometimes I have a hard time retracing the steps from the first moment to where I ended, but I know that it became a constant search for something to feel that way, if not that way better, just a little bit better. So when I became almost immune to the feeling of Percocet, there was morphine. So morphine was available, and when I became immune to the feeling of morphine, there were patches. So everything that I used built on the next. And when I became completely immune, when I say immune, I was no longer feeling high. Someone showed me how to snort a pill, and it took my addiction to another level. And at that point, the gates were wide open. So whatever I could find is what I used.
As addiction progresses, the addict pulls farther and farther from family and friends in an attempt to conceal the problem. Unfortunately, this does not protect these people from the ongoing decline. In addiction, relationships are strained and many are destroyed at the hands of illicit substances such as opioids.
No one truly knew what I was doing. Nothing had come out at that point. So I'd hidden it really, really well from them. So, but my relationships had all disappeared. I have a best friend, and the relationship with her just it took a toll on that relationship. I just stopped calling. I stopped going around, and when she would come around, I would hide, because I knew if someone really truly looked at what I'd become, they could figure it out. If they could see really truly what was happening, they would figure it out. So it destroyed everything. It destroyed every relationship I had. During active addiction, it destroyed my entire family.
The first step to recovery is admitting there's a problem. Many addicts get to this point, but this by no means is the hardest part. The grip of addiction on our minds and bodies is difficult to break. As addicts attempt to break the grasp of the substance, the body and the substance fight back with withdrawal symptoms that can make recovery seem impossible.
And those were the most miserable days of my life. And if any addict would tell you, and if anyone would ever experience withdrawal, they would never tell someone, why can't you just quit? Why can't you just stop? Why don't you just put it away? Just put it down. Because that was said to me, just walk away from it. You can't just walk away. My choices were gone. They were gone. If I didn't use, I would be sick. So that drug ultimately had control.
Recovery is a lifelong commitment. Once addicted, the brain is always addicted, meaning that the person is one decision away from relapse. Leanne understands that every day is a gift and that she must commit to a sober life on a daily basis.
Because when you start this program out, when you start on the journey to recovery, it's a minute at a time, maybe 5 minutes at a time, an hour at a time, 4 hours at a time. You take it that way because honestly, sometimes that's all you have. But by the end of the day, you can lay your head on that pillow clean and sober, and you wake up the next day and you start a new day. So when you hear just for today, that's the reason why, because, you know, putting too much on your plate a lot of times can lead to relapse. A lot of people can use those things as a reason to relapse. So daily walking out a lifestyle of recovery, and it's not, I don't think about using every day. I don't think about using every other day. Sometimes I go a long time without having any using thoughts or those things going through my head, but I'm 10 years clean. The day one, I had every minute I thought about using. So it's taken me to this point to get to where I just walk out a normal life. I live life on life's terms, knowing that my disease is doing push-ups in the background, just waiting on me to screw up.
Leanne's twin sister Laura has been with her throughout recovery and now helps others with addiction as well. The key message is commitment to the addict. Even though family and friends want someone to be sober and it can seem very difficult at times, it won't happen until the addict makes the decision to start the journey to recovery.
Don't give up on your loved one. As hard as it is, and I know the active enabling is very easy to do because I did that with her, with Leanne. I gave her money for her bills and things at the time when I didn't know it was for drugs, and even when I think I maybe assumed it was, I still wanted to help. There comes a point where you do cut them off for those things that enable them to continue to use and abuse drugs and alcohol. However, don't stop supporting, don't stop loving, and don't stop praying for your loved one or your friend or whoever it may be, because it may seem like there is no light at the end of the tunnel, but I promise you the day will come if you can just stand and be supportive in the best way you know how, that day will come that they can be set free from addiction. There truly is freedom from addiction, because I remember sitting there thinking, God, I can't wait for this all to be over. I felt like I was in the midst of hell, watching my family be ripped apart. But the day finally came as I continued just to love Leanne through her addiction and support her. And here we are 10 years later.
Leanne's daughter, Maddie, is her only child that was old enough to recall the darkest days of her mother's addiction. And after living through such a difficult time, recovery has meant a unique yet ever-growing relationship.
I'm so proud of the journey she's taken just to get control back of her life, because that adds so much trust in our relationship. One big thing is trust now in our relationship, because when I was little I never trusted her because she let me down, and so trust is a huge thing with her and I, and honesty.
Leanne knows that there are millions out there right now battling addiction, and that she has a message that can only come from someone that has walked the path of addiction and recovery.
The obstacles that are placed in front of you day one, going back to just for today, there's still a possibility to recover. Recovery is possible. Placing the right things and the right people in your path is very crucial to recovery. And my message would probably be that, you know, our best days high cannot compare to our worst days when we're clean.
And yet, silence and isolation will lead to the deaths of thousands each year. Addiction must be brought into the light so we can all help battle the greatest drug epidemic in U.S. history. Until we treat addiction as a disease and understand the difficulties and challenges on the path to recovery and work towards recovery, we will continue to lose significant numbers of entire generations.
The anonymity of this disease, I think, is what's really killing us. People not willing to come forward or not coming forward to tell their story of sobriety for fear of the stigma and the backlash from what are people going to think, and, you know, how did you get that way, and what is my job going to think, or what are my peers going to think? People just don't choose not to come forward. There are more recovering people than you know. They just choose not to tell their story.
The entirety of the Ripito interview will be available on our website at StantonMD.com. It's time now for 5 tips for healthier living. Today we'll talk about travel and vacation safety. First, make sure that vehicle is up to the task. Make sure all the maintenance is done, the tires are in good condition, and all the fluids are topped off. Next, you want to make sure that you have all of your medications with you. I often see patients in the ER who are traveling and forgot their medications, resulting in decompensation and condition. Also, keep any pertinent medical information with you, along with emergency contacts and regular physicians that we can contact in times of need. Take breaks, especially on long travel. You should get up and walk around at least every couple of hours, especially on planes. This will help decrease the risk of clots forming in the legs. Finally, if you have travel internationally, know the risks where you're going and make sure friends or family at home know where you are and how to contact you. If it's a country with significant food or water-related illnesses, stick with low-risk foods and bottled water. This can prevent a great deal of distress when many miles from home. That's all the time we have for this week. Please visit the StantonMD website for past episodes and more information about the show. Like us on Facebook for more content and to learn more about our sponsors. If your business has technology or a practice that promotes health and safety and you want to be featured here on StantonMD, please contact us at info@StantonMD.com. That's info@StantonMD.com. Until next time, I'm Dr. Ryan Stanton, and this has been StantonMD.